Welcome everyone to our April Lunch and Learn. I am Amanda Lakin, Communications and Member Relations Manager for the Coalition, and I have just a couple of announcements for all of you. As always, we are going to record the session and we will share the link with you along with any slides before the end of the week. And as always, you can always go to our YouTube channel to watch our past Lunch and Learns and any other educational webinars that we have there, and I will share that link to our channel with you. And hopefully this is the first time that you are logging in. We had an email go out at midnight last night letting all of you know that the Lunch and Learn was starting at that time. So apologies for that. Our system has been a little glitchy lately. You may have seen some Lunch and Learn emails go out at weird times. And I do know that some of you still have issues registering for our events. So we are hoping to transition to a new system sometime before the end of the year after our conference. But in the meantime, please bear with us. And if you ever have issues registering for an event, please reach out. It takes me about 30 seconds to register you. So thank you. And if anyone has any recommendations for programs that they use as a nonprofit, we would love recommendations as well. Next, we just want to remind everyone that this coming Monday, May 1st, is our Affordable Housing Day at the legislature. Share that little slide with you. Registration is still open for this day. It's going to be from 10 a.m. to 2 p.m. And we're really excited. We have a great number of registrants right now. We're going to have a tour offered that day. There'll be opportunity to be announced on the floor. And we have an amazing barbecue lunch prepared for everyone with vegan options. And I want to give a special shout out to our lunch sponsor, Ovation. Thank you for your support in this area. I'll be sharing the link to register and the agenda. Again, spots are open still. We just encourage you to register so we can provide you with a packet and a name tag that day. And lastly, our annual Nevada Housing Conference will be October 11th and 12th in Las Vegas at Circa Resort and Casino. And we still need sponsors. So if anyone is interested in being a sponsor this year, please reach out. We love our sponsors. They are one of the main reasons why we are able to put on such an amazing event for our attendees. We have a lot of levels to choose from, so I will be sharing the link to the sponsorship packet as well. And likely there are a few of you on the call today that will be reaching out to sponsors. So we just appreciate your consideration and support. So I will turn it over now to our Executive Director, Christine Hess, who is going to lead and moderate our session today. Welcome, Christine.
Awesome. Thank you so much, Amanda. And I am so excited about today's session. So as everybody knows, the work of the Coalition, of course, we're a statewide nonprofit, 501c3, working through education, advocacy, and collaboration to advance and promote affordable housing for all Nevadans. This session today, this program today, really touches on actually all three of our priorities: advocacy, education, and collaboration. So this work that you're going to hear about today is one that we're grateful to have CSH bring to us from the Mountain West, a program in Denver. And it really has helped inform the policy committee of the Coalition in terms of solutions for supportive housing, right? The housing solution to end homelessness. A very simplified statement, but we'll hear more about supportive housing. So today you're going to hear a little bit more about supportive housing, but in particular, you're going to hear about a policy solution in the West that has actually measured outcomes that we're hoping we can replicate here in Nevada. And right now, we have Assembly Bill 310, which we'll talk about a little bit more this morning, that is sponsored by Assemblywoman Danielle Monroe Moreno. And it establishes a supportive housing development fund. So what is it, the why, the how, and what's it based on, and what might we expect if we implement Assembly Bill 310? That's all part of today's conversation. So I am not the supportive housing development or supportive housing expert for sure. I'm going to lean on my board member and also our Southwest Regional Director from CSH, or formerly known as Corporation for Supportive Housing, Brooke Page. So I'll turn it over to you, Brooke.
Thank you so much, Christine. and appreciate you all very much for taking the time to participate in today's Lunch and Learn. As Christine mentioned, my name is Brooke Page. I use she, her pronouns, and I'm the director for the Southwest, but I'm based here in Las Vegas, Nevada. So this conversation hits home for me because I am very much a Nevada native and really admire the work that CSH has done nationally to help scale this intervention of supportive housing. So I thank my colleague Katie, who is joining me today. And we are going to have a conversation about supportive housing, but just for those who don't know or haven't been exposed to CSH, we are a national nonprofit organization as well. And we work across the country scaling and providing trainings, policy recommendations, and consulting to really help communities seed and develop supportive housing. We also have a lending arm. We're a community development financial institution. So we also provide some of those early stage lending to support these projects to get off the ground and move. But we are coming today from using multiple hats. We're educating and advocating for some policy that we're working on. So I've already introduced myself. Some of you may have known me working as the director of the coalition or as part of the board of directors with the coalition. But in this hat of the director for Nevada, I'm really working to really help educate around supportive housing. And I'm so excited to be joined by Katie. Katie, you want to introduce yourself?
Hi, everyone. It's a pleasure to be with you this afternoon. My name's Katie Bonamasso. I use she, her pronouns. I am based in Denver on CSH's Mountain West team. So primarily the team of folks I work with works in Colorado, Wyoming, Idaho, and Montana. But I also work kind of all throughout the mountain or through the Western United States. Currently I have projects in Portland, Los Angeles, Anchorage, Alaska. I've worked in supportive and affordable housing programs for 20 years. When I say that, it makes me feel really old, but I am passionate about this work and so excited to share with you all today a great program that I had the pleasure of being the project manager for the Denver Social Impact Bond Initiative. So thanks for having me.
Awesome. Thank you so much, Katie. And so today, as Christine mentioned, we're going to lay some foundation around what this new policy is that we're advocating for and talk a little bit about supportive housing and why this intervention that's already happening in Nevada, working really well, but we want to scale to really address the needs for folks that are not everybody is housed in our community. And so we really believe that this intervention can help us really address a need. And then Katie's going to talk about the Denver Social Impact Initiative. And so the Nevada Supportive Housing Development Fund, or also known as Assembly Bill 310. And so we're grateful, shout out to Assemblywoman Danielle Monroe-Moreno, who has taken the lead on helping us demonstrate and put this policy through the legislative session this year. I'm learning a lot about the process and really excited to be going on this journey with the coalition as their lead policy. But we wanted to kind of lay some ground rules as to why this bill and why supportive housing. And so for those who may be new to supportive housing, CSH, as the Corporation of Supportive Housing, we have really been working across the state to really, or the country, to really help educate on what supportive housing is. And there's some tenets about it that are really important. And I do want to just make sure that folks are aware that we do supportive housing in Nevada. There's some really great projects that are happening across the state. A lot of what we do entails leveraging our private market landlords and scatter site housing, which our property partners are a huge partner to addressing a lot of our unhoused neighbors, housing them and working with our subsidized programs, whether it be through the continuum of care or other funding sources, right? There's a lot of work that is happening in this space. And what we are advocating for is to scale it and to be able to have more single site options for folks in our state to provide and co-locate services and really help with the opportunity to bring more of these housing opportunities to across the state of Nevada. But part of what we educate on is what supportive housing is as a solution. This is affordable housing. Sometimes I hear folks talk about workforce housing, or I hear a lot of conversation about, just various different affordability phases of the affordability spectrum, and supportive housing falls on that spectrum as well. A lot of the folks that are housed in supportive housing may fall anywhere between below 50% of area median income. But the one thing about supportive housing that makes it so important is the fact that there's folks that need certain levels of service, that need help getting access to an affordable place to live, and help being able to help those folks stay in a stable environment is what is so important about supportive housing and that service piece and component. And also, having the ability to identify an affordable place that may be low barrier, or what we call, not having so many restrictions that keep people out. We know that there might be folks that have prior evictions or prior things that may be impacting them from getting a place to live. Having a supportive housing, affordable housing place for folks to go, with the services and the wraparound supports, helps folks get into a place where they can start, working or get access to healthcare and resources. And so this is what we are advocating for in Assembly Bill 310, is the supportive housing model. And so I wanted to just kind of give an overview of what the key features of Assembly Bill 310 are. And this is really the opportunity for us to codify in statute what supportive housing is, defining it, but then also creating a structure where we are actually going to develop it and provide some resources to supporting our current affordable housing tools, and provide resources to get those service dollars to the table. I've talked with a lot of developers and asked, why we don't necessarily have a lot of supportive housing in our state that's single site development. And a lot of the conversation has been around the lack of services and the lack of those service resources at the table. And so this provides us with the seeding of putting our money where our mouth is, putting those services into fruition so we can have the tenancy support service staff and resources to help people get access to housing and get them into housing. And so it establishes essentially a grant program where if there is a supportive housing development that's being worked on, maybe it's an affordable housing development that has various different affordability in it, but they really want to provide supportive housing, they can apply to the Nevada Housing Division for a grant for their service package. And so identifying what that service budget is, they can apply for that through this program and get access to those resources to bring those services to their development. It also provides an opportunity for us to work across sectors. There's the Interagency Council on Homelessness to Housing that is already in our state. They work on homeless policy at the state level. This provides an opportunity to bring that body into the conversation to help with evaluating and supporting the staffing to get a grant program off the ground and getting those grants evaluated, but providing recommendations back to the Nevada Housing Division, who ultimately would be administering these funds and getting those resources out the door, which they do so well already. So they already have that infrastructure in place. This is just to kind of enhance so we can do more supportive housing in our state. But it also provides an accountability back to the governor, so that way the governor gets an update on where these resources are being spent, how they're being spent. Also, the chair of the Interagency Council will get updated on the program. And we appreciate it as well because it provides some alignment. There's that cross-sector piece. We know that there's other sectors that impact our homelessness system as a whole, right? Between the justice involved population, our folks coming out of the healthcare systems, emergency rooms. And so we need a cross-sector process, a cross-sector conversations in order to address these challenges. And so once the grant is set up, we'll provide an opportunity to accept funds, and we really are hoping that the community, whether it be rural Nevada, frontier, our urban core, will apply for these resources. So folks can start developing these types of projects in their communities. Right now, we're asking for $32.2 million to actually seed it, so we can put those dollars in play and start addressing the need, and hopefully provide enough resources to at least start. We know that we've got right now, CSH has modeled that there's about 7,000 people that need this intervention. So that's kind of a drop in the bucket, $32.2 million, but at least it's somewhere for us to start. demonstrate this intervention and this type of process in our community with this infrastructure. And then we can sort of, have the ability to have other funders also contribute to this pool. Part of the legislation provides for that opportunity. So if there's philanthropy, if there's private business, if there's gaming, or whoever wants to also contribute to this fund, the legislation provides for that opportunity too. So it's state resources and other funding sources. But one thing that we would definitely want to emphasize about this bill is it provides the opportunity for us to measure the outcomes. We know that supportive housing is the most cost-effective way to support a person with getting off the street, getting them housed, helping them get resources and access to proper primary care and the proper types of resources that they need to stabilize. We know that that's more cost effective than letting somebody cycle in and out of emergency rooms, in and out of the jails, in and out of our crisis response systems. And so we want to demonstrate how effective that is here in Nevada. And so we're going to be measuring who gets access to these resources and how cost effective it is for us to be doing this, so we can report back to the legislature about the progress and how we're moving and how the program is flowing. So that's kind of what the bill is and what it does. I do want to kind of emphasize what it's not, because that's important too. So this is not a new tax. We're not asking for new taxes to be put to this. We are working right now with the Assemblywoman on kind of understanding that there's a budget in place, there may be a surplus in place. We got the economic forum coming soon. And so really finding where the right source is for us to demonstrate and seed this. We're allowing the Assemblywoman to kind of manage that process and kind of identify the funding source, but we're not asking for a tax. And so this is also an opportunity for us to demonstrate permanent housing solutions for people that need this level of intervention. And so we are targeting developments and supportive housing programs that are focused on long-term solutions. And so, there might be projects that are doing great work in recovery housing or transitional housing, which are great and important programs. This particular fund would fund those that are doing that permanent housing solution. This is also not a siloed funding source. So again, that cross-sector process, we are working at the ICHH to make sure that we're communicating with our justice involved partners with the Department of Corrections, that we're working with our Health and Human Services Department, who has Medicaid resources and that can also leverage those resources. We want to be able to make sure that this is going to be a sustainable opportunity for our state, and we can't do that isolated and operating in a silo. And then also, this is not for high barrier types of programs that have maybe a lot of restrictions or may not be as focused on, kind of lowering barriers to entry. We really are hoping that projects that are coming forward for these resources are the least restrictive, that are helping to get the right type of services to the table, the right type of resources, so we can get people housed and off the street. All right, so that's a quick overview of AB 310, and we're doing this because we know, again, we've got some data to support. We've got a rigorous control evaluation that was done in Denver that Katie's about to speak with. But I just want to kind of end on a note that, supportive housing works because it's evidence-based, it's demonstrated, it's researched. For 30 years, we've been tracking this intervention. So that's why we want to be able to scale it and build upon what's already happening in our state and do more of it. So I thank you all so much for your time today, and I'm going to pass it over to Katie.
Awesome. All right, so now we're going to talk about what supportive housing looks like in action, and use the example of example in Colorado of the Denver Social Impact Bond Initiative. So let's start with going over some basics for the project. So this was an initiative that started in 2016 and was a 5-year intervention period that ended in 2020. We released all of the final outcomes in the initiative in July of 2021. We're going to share some links with you of all of the final outcome reports so that you can look at those on your own, but I'm going to highlight some key results in our conversation today. So the target population was 250 frequent users of emergency services in Denver. So what we know about people who experience homelessness is that there's this terrible cycle where people go from the streets into our local jail system, into our emergency rooms, into our detox facilities, and that cycle has terrible outcomes for the people who are experiencing it and for the communities that are providing these expensive emergency services. And so we created an initiative that leveraged $8.6 million in upfront investment from 8 private investors. Those investors came from a variety of different backgrounds. Some were philanthropic and foundation partners in our local community, but our lead investor was actually a bank based out of Chicago, Northern Trust Bank, which is an international bank that used their community investment dollars to contribute to this social impact program. And what's important to note is that this is not a bond in a way that you think about a bond in a bank. So this is actually this upfront capital connected to a performance-based contract, and outcomes are measured vigorously. So there was 2 primary outcomes that we looked at this initiative. So the first thing we wanted to do is bring people in off of the streets who had this frequent use, get them into housing and keep them housed. So the first outcome measure were days in stable housing. And the second outcome measure was reducing the number of days that people spent in jail. And so the way the program worked is we got this money up front from investors. The service providers in the initiative located people on the street, housed them in housing. And if we met the target outcomes in the initiative, the city of Denver actually paid our investors back with a small rate of return. So this was a way that the city could start a program like this without taking a risk, and allowed us to the city to pay for the great outcomes that were achieved. So like Brooke talked about, we used a supportive housing model. We know that this has a 30-year evidence base behind it. We did use a specific intervention or service model called modified assertive community treatment. This is an evidence-based practice that happens in the behavioral health world, where 80% of the services delivered to participants in the program actually happen in the community. So what we know is that it is easy as we can make services for people to access, the more likely they are to access them. And so we bring a multidisciplinary team right to people's homes. The teams on an assertive community treatment team are made up of psychiatric nurse practitioners who can prescribe medications, nurses, therapists, substance use specialists, peer specialists. We know connecting with people with lived experience can be really key to engaging people in services, and then your general case management services. And these services happened across 2 providers. We're so lucky to have worked with the Colorado Coalition for the Homeless and WellPower, who was formerly called the Mental Health Center of Denver. And we had 2 single site buildings. One was 100 units. It was owned and operated by Colorado Coalition for the Homeless. And another that was 60 units owned and operated by WellPower, the second provider. And then we had 90 scattered site housing vouchers where we placed participants in the program throughout the community with private landlords. As Brooke mentioned, there was a randomized control trial study connected to this program. This, I'm so proud to say, was one of the most robust studies that has occurred on supportive housing ever. We partnered with the Urban Institute. They have a great reputation for evaluation in this space. This evaluation, because it was so robust, was costly, so it was paid for by the city of Denver. They were really excited to see the outcomes in the program, and so it was important to them to pay for a high quality evaluation. So that was not part of that original $8.6 million. So you might be wondering, what did frequent use look like before the initiative began? So what I would say first is that this was a data-driven initiative. We looked at data across the health system and emergency departments, the homeless management information system, the homeless database, and then city and county jail and detox records. And we looked for the overlap for where people in the community were showing up in those emergency services in all three systems. And when we did that, we realized that 250 people in our community accounted for an incredibly high number of these emergency interactions. So the first was we saw 14,000 days in jail across a year period, 2,200 visits to detox, 1,500 arrests, 500 emergency room visits. And this all equated to about $29,000 per person per year for these emergency services that don't give us great outcomes. And that ultimately equates to the city spending about $7 million a year to kind of keep people in this terrible cycle. And so what we know is that supportive housing could help break that cycle, and the program did show us that. So we can talk about outcomes here on the next slide. So over the 5-year period in the program, 363 participants were housed. And in the first year, 86% of them stayed in the program. And we're excited about our evaluation because oftentimes supportive housing programs track housing stability rates over a 1-year period. But because our program was so long, we were able to actually track housing stability at 2 years and 3 years. And you'll see here, 81% housing stability at year 2, 77% at year 3. These are incredibly high housing stability rates for such long periods of time. And so what we know is that the intervention we put together helped people get housing and stay in housing. In addition to that, we know that it helped people reduce their time spent in jail. So there was a 38% reduction in jail days for the target population. We had set out to reduce jail days by 35%. People who work in justice-focused initiatives knows that recidivism is high with groups who often cycle, and 35 was our target, but we actually exceeded that target at 38%. And as a result, our investors made their money back plus a small return. And so you'll see we did divide our outcomes by investment. So some investors invested in the housing stability success payments, and some investors invested in the jail day outcomes. This was to kind of help us recruit investment on the front end and target our conversation with, let's say, foundations who were interested in the justice outcomes or ones that were interested in the housing stability. And ultimately, our investors ended up earning about $1 million back in return. They were generous and knew that this was for social impact. And so they actually shared some of their earnings back with the providers who did the work as a bonus. So you can see here that the program not only had great outcomes for the people who were using the services, but also for our community and for our investors in the program. So I'm going to share some of the fabulous research that the Urban Institute did with you all here. So the first thing we learned, we just talked about it, people in supportive housing had fewer interactions with the criminal justice system on average than people receiving usual care in the community. So the randomized control trial, we found matched pairs for every participant in our program, and we're able to look at people in both the treatment group and the control group. So you'll see here, the yellow line is participants in the program. The blue line are participants in the control group. And we saw a reduction in police contacts, arrests, and days in jail. So significantly reducing all of the interactions with the justice system. In addition to that, people in the supportive housing used less emergency health care and received more office-based care on average than people in people receiving usual care in the community. So same setup on this slide. The yellow bars are SIB participants, the blue bars are control groups, and we saw a reduction of 40% for emergency department visits, and then an increase in preventative healthcare, which means people are getting appropriate services and they're getting the things that they need. So 155% increase for office-based healthcare visits with the psychiatric diagnosis. This means folks were getting into behavioral health and mental health, substance use treatment services, and then an increase in unique prescription medications. This means that people were getting behavioral health meds on board when they haven't had them for a long time, but also attending to chronic illnesses and treating their preventable diseases. In addition to that, people who were referred to supportive housing had fewer visits with detox than those who received services as usual in the community. So a 65% reduction in detox visits. That's massive. There was also a reduction in EMS response. It wasn't significant, but we included it here just because we know it's important and a service that our population tends to use. So what did all of this equate to? So what this meant was that approximately half of the total cost per person of the Denver SIB was offset by avoided costs in emergency public services. So you see reduction in costs for public safety, prison, emergency shelter, police, courts, emergency room, other housing assistance, ambulance, and jail. You can see here ambulance and jail are the most costly and where we saw the most cost avoidance. So reducing costs in emergency systems by about $6,900 per person per year. And just to kind of end by saying, you know, once you evaluate your programs, you can use the outcomes to really scale initiatives you know you need. So in Nevada, Brooke said you have 7,000 people who are in need of this intervention. Once you get your bill passed, you start doing supportive housing, track your outcomes, and you'll be able to do more. And that's what happened here in Denver. So the great outcomes from the Denver SIB led to the development of 2 additional initiatives. The first is Denver Housing to Health, or SIPRA. SIPRA stands for Social Impact Partnership to Pay for Results Act. It's actually federal legislation that allows the federal government to be an end payer in these performance-based programs. It has the same setup as the Denver SIB, where we're tracking, hoping to serve 125 frequent users of emergency services in Denver, and tracking housing stability, jail days, but also adding an outcome measure here where we're hoping to show net reductions in federal expenditures in Medicaid. And so when we applied for SIPRA, we were able to look at the data from the SIB, and it told us that on average, between our treatment and control group, we saved $5,800 a year in Medicaid costs. So that movement from emergency care into preventative health care is less costly. And the federal government liked our data so much that they agreed to pay for outcomes in that program. In addition to that, we're in the process of launching a program we affectionately call SWISHY, which stands for Statewide Supportive Housing Expansion Project. And this is also in Colorado. It targets 500 people across the state. So not just in the Denver metro area, we're going out into all of the rural communities across our state, working with 30 providers. And what it does is it pairs funding from the American Rescue Plan Act, ARPA, $10,000 per person per year in service funding with housing vouchers from our state housing authority. So our state Medicaid office that is using their recovery funds to work with our state housing authority to expand supportive housing across the state because of the great things that we did in the SIB. So I'm going to stop there and would love to talk to you all. Feel free to submit questions, and thanks for listening today.
Wow. Awesomeness, Brooke. Such great information. Like, really, we can do this in Nevada, you think?
Absolutely. And we're doing a lot of this already. We just need to track it and put some resources to it.
And why not? So I have so many questions. If anybody has any questions, feel free to put them in the Q&A and in the chat. And I know obviously I knew about this program because I had asked Brooke to bring Katie to our audience to share, but I'd never heard the presentation, and the results are really amazing. Katie, congratulations on that great work. It's incredible. Brooke, I don't know if you want to start and highlight a couple questions, but I have a couple myself, and I know you're not even prepared for them. So hopefully you'll be able to answer them, and if not, we'll figure that out.
Okay.
Oh, do you want me to start?
Yes, you can start.
Okay, great. So a couple things. Katie, obviously this was, well, actually, I don't even know the answer. Who led this? I was going to say, obviously this was led by the city of Denver, but perhaps it wasn't. Like, can you describe how the community came together? Like, who led the initiative? And can you also describe the role that law enforcement played, or maybe the MCOs or hospitals? Like how did that look at the community table for such a big initiative?
Yeah, that's a great question. The first thing I would say is that these initiatives are labors of love that often take a long time to put together. And so the data that I shared about what frequent use looked like before the SIB was actually someone who worked for the city of Denver in an office that's not called the same thing anymore, but it was at the time called the Crime Prevention Control Commission. And they had this realization as they were looking across data in the city that there was this group of people that was touching emergency services and no one was coordinating together around it. And so it kind of sparked this idea. And so I would start by saying the city really was the champion. And then it was kind of taken up by the city, who invited a Harvard fellow from the Harvard Kennedy School to come to Denver to work in the CFO's office and to think through, part of the goal of the Harvard Kennedy School was really, it was called the Social Impact Performance Lab, was to go into communities and think through how they could do these performance-based contracts, or think through supportive social impact happening in the community. And so when the Harvard fellow came and said, hey, we want to do a pay for success program, who has data that supports that, the need for any particular intervention, we had all of that great data from the Crime Prevention Control Commission. And so it took partners years to work together to really find the investors, put the package together. Some of the contracts can be complicated because it includes all of these outcome-based payments, but I would say the city really was our champion in bringing this to scale.
Awesome. And
Awesome.
We have a question in the Q&A that I also have, but I just want to follow up to what you just said, Katie, and put you kind of on the spot. As you hear our thoughts on Assembly Bill 310 and the work in Nevada, do you think we're on the right track? Like, do you feel like there's, as you've listened to us describe it, obviously in short, but are there some cautions you would give us, or some things that we absolutely need to prioritize? What do you, when you hear what we're trying to do here, how does that sound to you?
Exciting. First of all, like I said, a lot of times these pay for success programs can be so complicated. And now that we've done it and you've seen our data, you don't need to do something so complicated. And so I think you're really following down the right track by saying, we know this is an evidence-based intervention. We know the need in our community. Let's get the money together and let's get it out to the providers who do this great work. And so I would say, absolutely, you're on the right track, and well done.
Well, we got to get across the finish line.
Well, yeah, yes.
That day I woke up to support and co-present with Brooke and the Assemblywoman and ask for 32.2 million. I thought it was a great day to ask for that, but
yeah,
it was a good day.
We've still got a lot of work to do. The bill is moving, and I do want to. I have a question to follow up on our 32.2 million request, Brooke, but I see Rose has a really good question, and it's about those success payments. If you could explain a little bit about how the success payments work. I will say that is new to me, and I love it. I love the idea of a return on investment in that engagement. And then I also, of course, I wrote down, can our supportive housing development fund be a CIPRA? And I don't even know if that's the right type of question to ask, but can you maybe elaborate a little bit on the success payments for Rose and for me, and also what that looks like?
Yeah. So the way it works is that we received that $8.6 million in advance. The program began its intervention period, and the Urban Institute at certain points over the course of the project evaluated the outcomes. And so essentially the way it technically worked is that investors were paid per day of stable housing for each participant. And so we kind of worked into a backwards number, and in the end it was like $15.12 per day in stable housing. Of course, we subtracted days that people spent in jail or days that they might be out of housing in the hospital. But that's really how it worked. And then for every observation period, payments were made per stable day. The reduction in jail payments worked a little bit differently. So we had to get over a certain percentage threshold, and then there was a flat payment per percentage point over that. All of these things are kind of overly complicated. To be quite frank, we don't really do things this complicated anymore. So this is like kind of the way we put things together in 2014, 2015. And what we see now is kind of the shift away from pay for success into more performance-based contracting. And so we've seen government entities or states provide providers money up front to deliver an intervention. And then outcomes are tracked. And if they hit all of the target outcomes in the program, there's no adjustment to the payments that's made. If they exceed them, they might get a performance bonus payment. And if they don't reach those payments, they might take some money back. And so that really gets at the point of paying for good outcomes, not just giving programs money without looking at the way they work. And so thinking about the implementation of something like a performance-based contract in Nevada could be a great idea.
Yeah,
Brooke,
I just love that.
Yeah, is that something you feel could be an iteration or an evolution of the Supportive Housing Development Fund? Is performance-based?
Yeah, I think so. I think, the importance even of the developments that are wanting to go after this Supportive Housing Development Fund, being able to develop a budget to pay people livable wages, to be able to really provide the robust service package that's needed to do this work and do it well, and developing that budget without necessarily a funding source having to dictate to them how much they have to pay certain folks or what that has to look like. Having it come from the community, knowing how expensive it is to live in Nevada right now. I think that's a really great opportunity to create those types of budgets and then maybe have some resources in there to be able to incentivize performance-based contracting.
Awesome. And I know we're at time. I do just want to ask this one question because it stood out to me when I saw the slides initially. I got a sneak peek. But our request to the legislature is $32.2 million. And when I saw the slide that said Denver started, and obviously the 250 is less than we're thinking too here in Nevada, and we also have a great need. But when I saw that slide that said it was kind of catalyzed by an $8.6 million investment initially, can you just describe, I think, first of all, that $8.6 million leveraged other funding, but why are we asking for $32.2 million? Could we do it for less?
So it's a great question. And the $32.2 million is because, we want to do a statewide initiative to address and demonstrate this particular intervention in Nevada. And we've got the complexities of Northern Nevada are very different than Southern and our rural communities. And so we know that the modeling that CSH has done, that there's 7,000 people roughly right now that need this intervention. And so $32.2 million, unfortunately, isn't going to be enough to address the needs of all of those folks. But us demonstrating, getting at least a few projects off the ground, getting those evaluated and having some data to go back to, we hope that we'll have the argument to where we could sort of scale this in the future. But we need to start somewhere, and we want this to be statewide and not just one project or one location. So this gives us at least something to be able to get a few projects off the ground.
Awesome. That makes so much sense. And Amanda, I know I'm 2 minutes over, but I'm so proud of myself. I've done better than usual. I would like us all, thank you, a virtual thank you so much. Brooke, Katie, thank you for spending time with us. And again, congratulations on that amazing work and project, and really appreciate the shares. I can imagine we're going to have more questions for you, and maybe as we're establishing our supportive housing development fund, we come back to. So really appreciate the presentation and the sharing of information. And Brooke, thank you for your leadership.
Thank you, Christine.
Thank you for having us. Happy to answer any questions that come up.
Awesome. We'll be sharing the recording and the slides with everybody who's registered, which the registrations were just off the charts. I know it's a busy time, but we post these on our YouTube, and we have a lot of people that come after to listen to our YouTube. So we'll be posting those this afternoon. And with that, hope to see you at Affordable Housing Day. And I am going to say goodbye.